My name is Miranda Dominguez. I'm a primary charge nurse / ICU nurse on comprehensive care unit, and I've been with OSF for 8 years. At first, I wasn't afraid of COVID coming to us. I felt like it was going to be like every other infectious disease and every other sick patient that I take care of on a daily basis. But the moment I knew it was different was when we watched someone struggle to breathe. Oh, I'm going to cry. On a ventilator, and there's not much more you can do for someone at that point. And we couldn't run in to save them because we have to make sure that we're safe, make sure your coworker's safe, make sure you're safe before you can go in there to help that person. And we've had a few instances where the patient's struggling, but we can't just run in. Like, everyone has to stop and make sure you have your mask and your face shield and your gown before you can go in to help that person. And it's causing a lot of distress, moral distress between nurses. But then we have the stories like the honor walk where it feels like it might be worth it in the end, that we can help some of these people. Since we have to wear all the garb to go into every patient, all the COVID patient rooms, making connections with patients is different now. They can't hear you most of the time. They can barely see you sometimes, but we still find ways to make those connections and keep it human. The most rewarding part has been my coworkers. Some of the ideas that they've come up with to make patient care better for the staff and the patients, it just blows me away, the things that they can come up with. We've been doing some mask reprocessing to make sure that we don't run out of PPE so we can safely care for these patients. We're able to use extra tubing so we can put the IV poles outside of the door instead of having to garb up every time to go into the room to fix the IV pole beeping. I think for all of us on the unit, it's reinforced, like, I am here to care for these people, even though it feels like some days I'm at risk, some days I'm putting my family at risk, but this is what I signed up to do, and this is what I love to do. I know that I will remember this feeling for the rest of my life, and I can only imagine that the things I used to be stressed out about at work or at home they're not going to seem like anything anymore to be stressed out about.